community isn't aware of this whole person health and how very important mind, body, and spirit are in their interconnection, then we are not really able to treat people to their fullest. And so that is what Judson Center is trying to do, because we believe integrated healthcare is important for everybody. And we want to make sure that people are aware that behavioral health is something that is a medical condition, and we want to be sure that we are doing our part in reducing stigma in the community by talking often, talking early about our feelings, our coping, our strategies that we need support on to be able to be healthy, and that there is nothing wrong with asking for help. And so really reinforcing that is what we do also in our community advocacy, in our work with community coalitions, in our work with schools, is really to try and provide people with the knowledge of how to have easy access to behavioral health, and how we can help with our other partners in the community. And so that is really extremely important, is the partnerships that we engage in as a community, as a coalition, which you're seeing here tonight. We are all working together for the support and benefit of the community as a whole. And so that is Judson Center and our services in a nutshell. We do offer services to anybody regardless of ability to pay. So what that means is if somebody has no insurance, we still have open door. If somebody has commercial insurance, we are able to see them. If someone's coming to us through a community referral or community mental health, our doors are opened, because we have the ability to see anybody regardless of place of residence, regardless of ability to pay. We are what's called a certified community behavioral health clinic, and our primary health care practice is also a patient-centered medical home. Both of these designations are best practice standard designations for our fields. And so you could be assured that you are receiving quality care that is informed by data, that is informed through team-based care, that is informed through collaborations that we have both internally and externally to make sure that we are providing coordination and not overlapping services for people. It's all about ease of access and quality services that we really hold true to as a behavioral health provider.
Thank you so much, Sue. That was really a lot of great information for our attendees. Rosemary, are you ready?
Oh, hi, I'm as ready as I'm gonna be. No, I really thanks, Sue. I am here to talk about what it's like to live with mental illness from an individual perspective. Thank you to everyone who's being here. I can't see all the people that are here, but thanks for being here to learn something more about mental health and be part of the solution. I really want to thank Adrian Gasparoni for inviting me to speak here and for talking me up left and right. So I hope I can live up to half the hype. Timer's on. So considering that I'm bipolar and I'm living in long-term recovery with dual diagnoses, so maybe I can double the hype. As one of my mentors has often said to me, you do nothing by half measures. So anyway, I scripted in some crickets there, and enough with the pre-script puns. I'm not used to pre-writing a speech, but my time is a little limited. The subject matter can be kind of large, and I could and will literally write a book about this. So, and I'm pretty long-winded and love to tell stories, as the peanut gallery of my family reminded me. After 10 minutes, I'll just be getting warmed up, having finished saying hello. So that noted, it's really good to have supports that know you well, and even better to be able to laugh at yourself. So thanks, family, for all of that. Okay, so it is time that I turn dead serious. Like I said, I'm here to talk about my point of view living with mental illness and substance use disorders. Each of those is a condition that's been, excuse me, I get a little emotional about this. It's been proven to significantly shorten a person's life expectancy. And the more severe the sickness, the worse the outcome. So this is not the talk where I cite all the science, but something tells me that I don't need to do that for you to believe it. All you have to do is look anywhere and everywhere, especially right now. And so to get even more serious for a moment, with apologies, as this might be upsetting to some, people with co-occurring mental health and substance use disorders are dying at alarming rates. I have been calling this for a little while now, the secondary pandemic. Literally today, a couple hours ago, I got the news of an acquaintance who is now dead. Someone who, like me, had struggled with bipolar disorder and the addiction to multiple substances, some legal, some not. And while COVID-19 has taken so many lives in the past 2.5 years, and this is not to take away from that, in the same time period, more and more people are suffering with these disorders, which I'll call from here on out co-occurring disorder or dual diagnosis. That's what I mean. So I personally have known more people to die with and or from this than from that. COVID, that is. And ironically, the one person I know who died from COVID never used any substances. But the only point I mean for you to take away is that this is as big of an issue as the other, even if it doesn't get nearly the attention, funding, or acknowledgement as the other. So my talk is hopefully a way for you to hear something that can help you or anyone else you might know. And I want to dedicate it to those people that have lost their lives, including the family members that I've lost during the time of this pandemic. Okay, so now that I've already used up 30% of my time, let's get into it. Just really the facts. I would say I was an unlikely candidate to have this, be an advocate like this. And I take it for granted now because it's such a part of my language. But really not that long ago, I had no idea about any of this. In grade school and everything, I was a really strong student and overachiever and very well adjusted. No real traumatic events growing up, but there is a strong family history of mental illness and substance use disorders. And so sometimes maybe you don't recognize things that might be alarming. So I wasn't diagnosed with anything until I was in my late 20s, and I was diagnosed with bipolar disorder just before my 29th birthday. And I had never seen a psychiatrist before. And at the time I was also drinking heavily and had been overprescribed some stimulants and taken to a psychiatrist after I nearly lost my mind in grand public fashion. And at the time I remember thinking, are they going to hypnotize me? I didn't know anything about a psychiatrist. I was just thinking about Freud. And then I said, am I being hypnotized now? And it felt to me like the way that it had in my teens, experimenting with different hallucinogens. So what I never would have thought was that I was experiencing hypomania. I just knew that I felt weird. And again, I could go into a million stories, and I'm obviously not in the place to do that right now. But zooming out a whole lot, is what I really want to say hindsight maybe isn't 2020, but it becomes clearer. And the more that I learn, the more that things make a little bit more sense. But I'm here putting out these labels attached to me, like mental health and substance use disorder, ADHD, bipolar disorder. But really, I'm a complex human being, just like all of us, with a deep history. My story has layers. I have a past, a present, and a future, personality traits, maybe a couple or a few diagnoses. And, at the end of the day, what I really think is that stigma doesn't make any sense. And I'm going to tell you why. Because when you go to a doctor for some help with mental health, behavioral health conditions, whether that's mental health and or substance use disorder or whatever, you don't put a label on it. They have to put a label on it in order to treat, but they're treating the symptoms. Again, this is my opinion. You could just as easily not get help and not get the label and not get the treatment. And it's really, regardless, it's about the treatment. For years, for a decade, probably easily before I ever had this breakdown, which PS, there were all these major changes going on in my life at the same time, coupled with the substances to cope. I kind of had like a yearly breakdown every December around the middle of the month. It wasn't as bad as it had been, but I wasn't using substances at that point and didn't have as many pressures as I did when I was older. I never got help. I didn't know to get help. I didn't get help until there was no choice. And then I continued to follow the plan because I didn't want to go back into a lockdown psych unit without a choice to leave. So, I was asked to speak to the relationship between my substance use, drug use, and by the way, I definitely include alcohol in there as a drug, and mental illness. And I really can't come up with a cohesive story about which came first. I really think of it as a chicken or the egg scenario. When I went to that first psychiatrist appointment with my parents, almost 30 years old, there's a certain honesty and humility that comes out when you're in a crisis. It's like you don't have the energy to hide things anymore. And I asked the psychiatrist if any of that had something to do with all the acid I had done as a teen, because the feeling, whatever that was, probably a combination of some delusional thinking and hypomania, just out of touch with reality. And I asked him if it had anything to do with that. My poor parents had to digest that news in that moment. But he said, well, no. And I wasn't totally satisfied with that answer. And then a few years later, I was continuing my treatment, and it was still hard to get my meds adjusted. And I had already been committed once. It was a scary situation, and I never wanted to go back. And my psychiatrist, who was really wonderful with community mental health, saved my life. She asked me if I wanted to go back to the hospital again, and I was slightly relieved, which I was surprised to even think about being relieved to go back there. But in my instance, being in the hospital kind of made me, it's not a good solution because it's a very anxiety-provoking situation, turns out. And she knew that. So she said, well, there's this thing called IOP, intensive outpatient, like a day program. And, they can help really adjust your meds and monitor you. And so I said, okay, yeah, sign me up. And I met a really great counselor in there, a peer, actually, somebody that had kind of gotten through the woods and was proof that recovery is possible. And I asked him that same thing about the substance use and the mental health, and would I ever even have all these issues if I hadn't done that stuff? You know, curiosity kills the cat. And he told me, well, it's possible that you had it sort of in your DNA, and maybe it wouldn't have come out per se if you hadn't done that. And that made more sense to me. And then a few years after that, when I was getting my master's degree in health education, that was when I got into recovery and did way better in school that time again. But I learned about this thing called epigenetics, which is basically the interaction of your genes and your environment. And your environment not only includes the things that happen to you, but also the things that you put in your body. And, you know, again, like I say, it's always more will be revealed, but that just makes sense to me. And, you know, the labels, they are what they are. It's an easy way for, to hone in on something, but to wrap it up, I know that there's a Q&A period, so I'm pretty much an open book if you have any questions. The last thing that I want to say is that I really do personally, I wear the label bipolar with pride, even though I've definitely been discriminated against because of it. I work as a peer, and I really truly believe that whatever it is or isn't, it's been a protective factor in this last 2 years. Those of us who have been through the ringer already are almost at an advantage, because it's like, oh, I know what it feels like and looks like when I'm close to the edge, and I know what I need to do. So that self-awareness and having a toolkit and not being scared to speak up and ask for help, it's key every single day to this day, because life keeps on happening. So I guess that's it. I thank you for your attention. And again, I appreciate you inviting me to speak here.
Rosemary, thank you so much for your honesty and being so forthright. I think our panelists will get a lot from your speech. I'm going to ask Sue to turn her camera back on so I can also put the spotlight on her, and we can ask you a couple of the questions that we have. So the first question is, I think this would go to you, Rosemary. To the people who sought out support, was it difficult to take the first step, and why?
Well, for me, I guess technically the first time I got some support was as a student at Wayne State, just having gone through a difficult transition. And it was something that someone in my life suggested that I do. And they had a student clinic, and it was pretty easy. But when I actually went to see, and get psychiatric, that it was a step process. So I will say it was just one little step, except the times that were more of a crisis, and it just kind of was almost, there wasn't really much of a choice, I guess. So
Fair enough.
I can't, sometimes when you get into the mode of like fight or flight, or I think that fear ceases to be a thing when I look back at the things that I've been through. And I'm sure that we can all look back at the things that we've been through and go, how on earth, whether it's birthing a child or going through a really tough anything, I think that just isn't even part of the equation in that moment.
That makes sense. So I think the next question would be for you. What is integrated care, and why is it important?
Yeah, it really is that team-based whole person care that we talked about a little bit. I know Rosemary certainly referenced the importance of that whole mind and body care, the connection between your mental health and the impact it has on your physical health, and vice versa. You know, people with chronic healthcare conditions many times also have a mental health condition that they're struggling with, whether that is the depression or the anxiety or the intensity of situations like chronic care, that such as that with pain management. You know, it really can open the door to needing support on multiple levels, including your mental health. And so that is so important, because you can't have one piece without the other. You're healthy when you're a whole person healthy, not when just a piece of you is healthy. And it's important for us to really recognize that, and recognize mental health, behavioral health, substance use disorder, co-occurring disorders, as Rosemary's talked about, as health conditions, not as something else, you know, that we need treatment. It's a health condition, and we should be treating it like it's a health condition, talking about it like it's a medical health condition, so that we can help people feel comfortable to step forward and get that integrated care. And with the integration of care, we hope that that is starting to move the needle with removing some of the stigma around mental health, because it's just health.
Great. Thank you. The next question, I guess either one of you can dive in on. I don't know who to direct it to be honest, but it's how does physical health care intersect with behavioral health? And so I feel like you just talked about that a little bit, but if either of you wanted to elaborate, that'd be great.
Sure. You know, the intersection again is, I mean, I think the key word that's common between all of it is health, you know, and so it does intersect in so many ways. And with, you know, your physical health, there are some really chronic conditions that we find from physical health: diabetes, high blood pressure, obesity, to name a few, that are having a lot of research around being connected also with mental health disorders. And so, like we just talked about with the importance of recognizing the need of integrated care, it does intersect there. And then there's also the social determinants of health that intersect also, because people can't get the care that they need if they are struggling with food insecurities and housing insecurities and have no transportation or childcare. They're not going to be in a position all the time to be able to access the support and services they need for their whole health and mental health treatment, behavioral health, and physical health. That's one of the things with COVID, just to point out that we all learned to pivot very quickly and became really skilled at providing services virtually. That's opened up a lot of support for people that otherwise would not have had it.
Yeah. Do you mind if I add to that as well? I agree completely, you know, from everything from like the social determinant of health factors, like not having access to transportation or childcare to get to an appointment, or the money to put gas in the car that day or whatever, but then also, you know, things like social anxiety. Just to be able to go like that way via telehealth, if the technology is there. But and then also about the physical health, I just wanted to say, from the perspective of somebody that has lived, I agree about like conditions. I'll just speak about like bipolar disorder, which is probably my primary diagnosis. I have a couple others, including ADHD, but it's, to me, it's so important, crucial, key to manage my physical health. That's why I kind of consider it a blessing in disguise, because I have to get enough sleep at night. or I risk a mood episode. Other people might just be cranky. I literally will get depressed if I don't eat enough vegetables after a while, if I don't get exercise and bright light. So it's so integrated to the physical health for me. And I really think everybody is like that, but just maybe it's more sensitive in some than others. The chemistry feedback from your physical health.
Thank you so much, ladies. Rosemary, there were a couple of questions directed to you specifically that I'm going to ask, and you can decide if you want to answer them or direct message someone or say none of our business or whatever it is that you want to do. But we did have a question that asked if you became sober before you were diagnosed with bipolar disorder.
No, and I wasn't. I did not. And that's kind of why I say it seems like a chicken or the egg scenario, because like, was the substance use a self-medication, or was the mental health symptoms because of substance use? But no, I actually, and I just want to say, like, in general, everyone has a totally different path and everybody is totally unique and they have their own story, right? But for me personally, I more or less stabilized my mental health first. When I had my major episodes, they were when I look back, they were definitely connected to heavier substance use. So there was like a huge connection between my substance using and the mood episodes. So the first thing that I did was like strictly stick to my medications. And I did continue, drinking and using and not being forthright with my psychiatrist because I didn't want to hear it because I wasn't ready to make the change. But then when I did finally get sober, and I've been in recovery for 4 to 5 years now, my mental health got a lot better. Yeah.
Great, thank you. And then I think the last question is, sorry, I have to scroll up. I'm not sure if you know that Carl Jung said that the world is bipolar. It makes me feel better about being the same, and it helps me cope with big stigma. I guess my question is if you knew that he had that thought.
Hi, Monica. That's my bipolar bestie. I'm just going to say, since she said in the chat that she's bipolar. I did not know that he said that. But I am I'm a big fan of duality, and seemingly opposite things can be true at the same time. And Carl Jung was pretty brilliant, so I guess it makes sense.
I think that's a good way to wrap this segment up. Again, ladies, thank you so much for participating. I'm sure that everyone found everything you had to say more than helpful. So we appreciate your participation.
Thank
now,
you
of course, I'm going to remove the spotlight from Rosemary and Sue, and then introduce our next panelists. Let me get them on spotlight. All right. So our next panelists are Stephanie Lang, who's a clinical administrator for community mental health. And with her is Desiree Neal, who is a peer support specialist and peer recovery coach for community mental health. Welcome, ladies, and thank you so much for being here.
Thank you for having us.
Thank you.
Yeah, first off, I want to say, excellent job, ladies. You're a hard act to follow. I hope Desiree's not too nervous to follow you. When we practiced, we didn't have anyone amazing going before us. So I just want to say that. And also, I was just thinking, I was just going to kind of get right into peer support specialists and kind of what we do. But now I feel like, especially since I think Rosemary said that community mental health was part of what saved her life.
Mm-hmm.
I just want to say a couple of quick things about where community mental health came from, because it's kind of an interesting story that I did not know. until I agreed to be on this panel, and I've been working there for 15 years, so I'm a little bit embarrassed. So just quickly, in 1961, the Michigan Senate established a special committee to study community mental health services. And based on the recommendation of this special committee, and with support of then the Mental Health Society, identical bills were introduced in the House and the Senate in Michigan. And the act was designed to encourage the development of preventative, rehabilitative, and treatment services through new community mental health programs, and the improvement and the expansion of existing community services. And this was signed into law in 1963. And this law led to the establishment of comprehensive community mental health centers throughout the country, helping people with mental illnesses who were previously like warehoused in hospitals and institutions and able to move back into communities. And by the end of 1964, 12 counties in Michigan had established community mental health programs under this act. And Macomb County was one of several that made a formal commitment to study what was happening with other counties. And Michigan became a leader in assertive community treatment, which we call ACT, and psychosocial rehabilitation, which is our clubhouse services, and other services that support and provide services to people as an alternative to hospitalization. So it's kind of exciting. And today, Macomb County has expanded our services to meet behavioral, mental, physical, and medical health needs. And many of our services are free to the community and are, well, we hope easily accessible. I think they're more accessible now than they were before, for a whole bunch of reasons that we can kind of touch on at the very end after Desiree's story. But Desiree and I were asked to come today to talk a little bit more about, from the individual perspective, what it is like to have mental health needs and how to access those needs. And in our Macomb County program, we have crisis services, which could be a phone number, it could be a text message, it could be walk-in services in our county. We have services for children with emotional disturbances and people of all ages that have intellectual development disorders and disabilities and substance use disorders through our Macomb County Office of Substance Abuse, and all of our community partners like the Judson Center, amazing, one of our community providers. We really have to all work together to provide the kinds of services that are needed. And Rosemary, I love how you said, you know, everyone's story is so unique and nobody's journey is a straight line. You know, and so it's so important for the library and for Care of Southeastern Michigan and all these organizations to be coming together. I really feel privileged and honored to even be asked to be part of this, and to know people like Desiree and to be able to work alongside with amazing people like Desiree. And so just a quick trigger warning here, just like Rosemary so nicely gave to us. Some of the things that Desiree might share are very emotional and personal. And we honor your story, Desiree. And we also want to warn people that there is going to be some mention of sexual assault and sexual abuse. So just in case that is something that is very sensitive topic for you, we want you to be warned ahead of time. And Desiree, if you get emotional, just like Rosemary did, that's okay. We're just really honored that you're willing to tell us a little bit more about your journey to become a peer support specialist and recovery coach for our county. So anytime you're ready, I'm going to mute and you can go ahead and get started.
Thank you, Stephanie. Thanks for asking me to be a part of this panel, Stephanie. I appreciate that. And of course, Clinton-Macomb Public Library, the Justice Center, Care of Michigan. So I'm gonna start my story. My name is Desiree Neal, and I'm a peer support specialist and a peer recovery coach. And I just celebrated my 65th birthday on Sunday. So that's a milestone with mental health and substance use disorder. So I'm the youngest of 4 girls. We lived in a single family house with just the mother. Mom made sure and did the best she could, making sure that we went to school, we went to church, we were in the choir, and we also went to the community center. At that time, it was called the Tarman Recreation Center in Detroit, where we did ballet classes and also studied for Girl Scouts. Also living in Detroit on the west side, it was nice and clean. I remember walking down Grand River because we didn't have transportation, and sometimes we would use public transportation, but we did a lot of walking because the store, to get to church, to get to the community center, we walked those places, and of course to school. And what was kind of funny to me, last week, the kids in Michigan had a snow day, but I remember walking to school where the snow was almost as tall as me, and we still had to go to school. It was a snowstorm, and the snow was up to my hip, and Mom still sent us out to go to school. We were the only ones out going to school, but we had to go because Mom told us to go to school. And when we got there, of course, it was closed, and we went back home. And I also remember walking down Grand River, and it was nice and pretty and sunny at the time, I remember, and flowers and the barber shop and listening to the record shops. Well, we used to have the record shops in the old days. Well, not in the old days, back in the, I would say 60s and 70s. And you walk down the street and people playing music, and it was so nice and peaceful and calming that we all would get along and speak and say hello. I also remember going to the hairdresser as a young child. My mother, we had 4 girls, like I said, and she would send us to the hairdresser. When we went to church, we all be dressed alike in the same outfits. What was cute at that time. Anyway, every summer, we would go to New Orleans, Louisiana to visit my grandmother, my mother's mother. When we started, I was probably 5 or 6 years old, and we took the train, the long train ride from Detroit to New Orleans, Louisiana. That was fine. And then as we got older, I remember we started flying. We took the airplane. So, like I said, I was about 10 now. So in 1967, when the riots came to Detroit, we were on vacation because it was in the summer. We were on vacation in New Orleans, and we didn't come home till after the riots. When we returned home, a lot had changed. Since the riots, of course, a lot of stuff was tore up and burnt out, and it wasn't good. So we lived in a 2-family flat, and our landlord at that time, him and his wife got a divorce. So she got the house, and we lived upstairs, and we had to move because she wanted her brother to come live with her, which was fine. So we moved to, still on the west side of Detroit, we moved to public housing, which is the projects, Herman Gardens, Joy Road, and Southfield. During that change, I felt, God, because, okay, the riots there, so that tore up all the pretty stuff on Grand River that I used to remember, the flowers, the barber shop, and the record shop and all that's tore up and burnt down. So it was ugly. It was ugly. So we moved, and the move made me feel sad and lonely, not just because I was losing my friends because of that nice environment that we had, that the riot had messed up. When we moved, it was nice and clean. And then the projects, everything, it seemed like a box where we was caved in, and that's all it was. Not like living where we were before, where everything was open and you could see from downtown to where you live, and it was just totally different. And it made me feel sad and lonely at that time. I grew up in a house with a lot of cussing. Always being told you're ugly, you stupid, and being talked down to. And I have to be honest, I do a lot of cursing too in my house. I remember when I was taking my 2-year-old daughter to daycare, I said, Jasmine, there go Jason and Tony, a boy from the church, and her babysitter. And she said, I see them MFs. Of course, she said the word. She was 2 years old. I'm saying, oh, Lord, I had to look at myself and say, I'm doing a lot of cussing for that 2-year-old to say that. So I looked at myself and I checked that out and trying to stop cursing as much as I used to. To be honest, no, because my grandson, 8 years old, he's a cursor too. But I don't know, we just picked it up and we cursed a lot. I tried not to. So we was always being yelled at and talked down and being told that you stupid. And that made me close up and shut in inside. And then I had low self-esteem. And as time went on, one year, instead of going to my grandmother's in New Orleans to my mother, my father wanted me to go visit his mother in Savannah, Georgia, where I went to go visit her for that summer. It was nice. It was different, of course, from Georgia to Michigan. People act and talk different. When you walk down the street, everybody speak to you. Hey, how you doing? And that was different from what I was used to. I remember walking to the store, and it was just different from up here. And they didn't have sidewalks either down there. So yeah, that was funny and different. My grandmother was happy to have me come stay with her. Around this time, I was 13 or 15 years old. So I had some relatives that's, of course, in Georgia, because that's where my father's family from. So I was staying with my grandmother and my grandfather. One of my relatives, he was married and they had a little child, and they would come by and pick me up and take me to their house so I could get away from my grandmother and be around younger people. So I like going over their house and spending nights, and my aunt, she took me a lot of places and spent time with me. But something happened during that summer where she passed away. She had an aneurysm of the brain. And about 2 days after that, my uncle came to the house and asked me, did I want to go over to his house? And of course I said, yeah, just to get out the house, not knowing that he was planning on having sex with me. It broke my heart. I said no, and he didn't listen to me. That was the first time I remember I had to suffer in silence because I couldn't tell nobody, and who would have believed me anyway? And I went through that. And after suffering in silence, I came back home, but I still didn't have nobody to share or to tell my story to, because nobody would have believed me. So I kept on suffering in silence. When I was in high school, I went to go live with my father in Ann Arbor. I left Detroit, to go live with him, to lead the projects, to move into a house and all that. Loved my dad, that was my heart. He would visit me every weekend and take me to his side of the family and stuff like that. Anyway, living with him in Ann Arbor during my high school year, one snowy night, he called me into his room. It was kind of late, about 8:30, 9 o'clock. We go to bed. I'm like, damn, this is strange. So I went in there anyway. So he said, lay on his lap. Lay on your lap? 15 years old. This is totally out of order. So I'm getting scared and nervous. Like, something going on here that is not right and that should not be going on. So I laid on him and he touched my butt and I jumped up and screamed, and the houses were really close. And we lived in a predominantly white neighborhood then. We didn't have no black neighbors in our neighborhood. So I guess he didn't want them to hear me screaming with the house being so close together. So I left and I walked to Kroger in the snow that night. I called a friend. Her mother let me come over to her house that night because it was late at night and I had to get a cab over there. So I couldn't believe that my dad would try something like that. He was my heart. He was my everything. Somebody that you put so much trust in. And for somebody to do that to you, I don't think people know what they do when they touch a person unwillingly. Don't do that. God, that brings so much pain. Anyway, I moved back to Detroit. I came home, still suffering in silence. I told 2 female relatives what had happened to me. And one said, "Oh, have y'all done it before?" Damn, she is sick. And another one just came out and called me a lie. So I didn't have nobody to talk to, just getting out of high school. So here's this little girl still inside of me, hurting, crying, waiting to tell somebody what happened to her. And nobody didn't want to know what happened to me. Nobody didn't want to know what was wrong with me. But when somebody do that, it's the worst thing ever. It's the worst thing ever. And that's what holding all that pain inside me and not having nobody to talk to, no family members or nothing. I kept it in and I held it in silence. Another thing happened. Wow. In the late 70s, I got gang raped. And I was working at Camano's Cancer Institute, and I happened to see one of those people. And I just wanted them to apologize, but they didn't apologize. They said, "Oh, what's your phone number?" I said, "Lord have mercy, I can't do this." So of course I didn't get my phone number, but I just wanted an apology from anybody. I never got an apology from nobody for what they did to me. What they did to me, I didn't ask for it. It wasn't nothing that I did. And I had to tell myself it's not my fault, and I had to live like that. So I came home and got a job. That kept on and kept on, just kept on living and didn't know what to do with nothing. So I'm moving on. I moved to West Palm Beach, Florida in 1987. I got married and had a daughter in 1992. Still haven't talked to nobody about what happened to me. Still working and living life the best I could with the sadness and withdrawal, and always fearful that something unpleasant would happen to me again that I didn't have no control over. 2014, I had another traumatic event, but this time it was physical. I had physical problems. Well, I was working full-time job and I worked a part-time job, but since I had physical injuries, I had to stop working. Well, I had a check coming every week and I like money. And then it all stopped because I wasn't working no more due to this physical accident I had. So I went to my primary care. Had to go to the doctor. I went to my primary care, and of course he was talking to me. And he asked me, "Have I ever seen a mental health specialist before?" And I said, "No." He said, "Well, would you like to see one?" And I said, "Yes, it can't hurt." The funny thing about this, it was at Henry Ford Behavior. And when I stopped working there, then I went there as a consumer. And I got some treatment. I saw a therapist there. And I guess my insurance changed and I had to then go to Macomb County Community Mental Health. I went to North and I was seeing a therapist there, best lady in the world. Her name is Beth. And when I would always go see Beth, I would always be on my way to a meeting or on my way to something else because I'm a peer recovery coach and I'm a peer support specialist. So I had to do diagnoses too. And I would always be on my way to a meeting or doing something. And one day she said, "Desiree, I have a job for you." And do I look like I'm looking for a job? I just had 2 jobs. I can't work. But that was physical work. She had something for me that I had to use my brain. I had to go to training for a peer recovery coach. They let you work, but after 3 months or something, I believe, they want you to do the training and get your certificate. So they teach us what to do. So I did that. But when she asked me did I want a job, I'm like, I'm not looking for no job really. But this was the best job that I ever had. When I saw how much I was making, how much I was gonna get paid, I'm like, oh no, I can't make that much money because it was scary and it was
It's
the
like a
best thing.
miracle happened,
It
Desiree.
was a miracle from all the tragic events that finally happened. And the thing about it, I was like 49 years old when I first got diagnosed. We went to primary care physicians, but we didn't go to no mental health doctors back then. My mother didn't. And I just didn't know where to go or how to get resources. But now it's a lot of resources available to you for anyone to get help or talk to a family member or talk to a friend or talk to your primary care doctor. But it is a lot of help out there.
Desiree, your story is so powerful to me in so many levels because you had so many very pivotal moments of your life that changed, what was going to happen between people dying and moving around. I mean, things that were 100% out of your control, and I remember when you first told me your story, I was thinking about the riots, and I know so many other people whose lives trajectory was changed when those riots happened in Detroit. And so when all these different things happen to us, you said another really important thing that people might say, what's wrong with you? But they don't ask what's happened to you. And that's where we can begin to figure out, how to stop suffering in silence and how to get to someone who is going to listen to us and is going to believe us.
Yes.
Because that is how you are going to be able to heal. So, hey, age 49 is better than never.
Yes, it is. And I'm so grateful for that because it changed my life and it gave me tools to use. And one tool that I use a lot is, they call it block breathing. And I'm going to do it real quick. So I'm going to breathe in 4 counts. I'm going to hold it for 4. And I'm going to let it out for 4. And once again. And that helps me and slow me down and slow my heart rate down. Of course, I do it longer. But even this afternoon before I came on here, I had to do the deep breathing block to slow me down because I was so anxious. I was so anxious. But I do want to share this, that recovery is possible. Don't be afraid to ask for help. We do get better and we do recover. Like I said, when we help one person heal, we helping the family heal. Because most of the time, that person, mental illness or substance abuse, it affects more than just that person. It affects everybody in the household. So if we could get one person to heal, we're making one family heal, and sooner or later that community is going to heal too. So let's just try to get better and grow, and we'll be surprised what our life can be. I mean, I'm a living example. I used to do housekeeping and caregiving, which is nothing wrong with that. Somebody got to clean up and somebody got to take care of people. And I love doing that and being helpful. But with the peer recovery coach and peer support specialist, we are helping people on a more personal level that your life can change and it will get better. But you have to take the steps to do it.
And Desiree, I see a question in here. I'm going to say a couple of things about it, and then I think Rosemary and you should actually talk about it. But there's a whole bunch of different kinds of peers. And there's veteran peer, which we have in Macomb County. So we have someone who is a person with lived experience with a mental health diagnosis and is also a veteran of the armed services. There's youth peers, which are people age 25 and under, that have experience as a young adult or an adolescent growing up utilizing the services in the public mental health system. There's peer mentors, which are people with intellectual disabilities that are now able to support other people with intellectual disabilities. We have parent support partners who are parents that peer support other parents who have children going through the public mental health system. And then we have what Desiree and Rosemary are, which are certified peer support specialists and recovery coaches. So Amy, why don't you take me out of here and let Rosemary and Desiree answer some of these questions about what peer supports do, because I think it's a service that's horribly underutilized and that people don't really know to ask for this service.
So what was the question?
The question is, people want to know, like, can you give an example of what a peer support specialist does? When would you use one?
A peer support specialist, of course, is someone with lived mental health experience. So what I do, I talk to them. We do the RAP, which is Wellness Recovery Action Plan. I love the RAP because we do a wellness toolbox, and you have to have that toolbox to put things in, whatever help you feel better, like reading a book or taking a bath or doing the deep breathing or calling somebody. And we also do the one-on-ones at our facility. We do a microwave cooking class. We have chair yogurt, and we do the groups. We have a garden, and when we plant the garden, of course, whoever the people that help plant the garden, they get the first choice to the vegetables that we grow. Rosemary, you could share what you do as a peer.
That's awesome. I loved your talk too. So yeah, I mean, a peer can do so many different things day to day, but yeah, one-on-one and groups. But the biggest, like the biggest overall is just, as opposed to other professionals where like maybe it's part of their ethics that they can't share, even if they have been through things, that's not the role that they're in. So they can say, you know, oh, I can see how that'd be hard. And if someone says, well, what about you? Have you ever been through it? You know, maybe they're not even supposed to say. But as peers, you know, it's not about us and our therapy, although it does help, right? To be able to be who you are and help people and know that it's actually a part of the qualification of the job to have these issues. And not like I'm gonna get fired when they find out, say, but like what we do is just, you know, we coach. And then if somebody is having a hard time like with this or that, we can go, you know what, I went through this and that and I got through the other, and this is how I did it. And sometimes it's just planting a seed. You know, in the emergency room, I would see people, sometimes they were not ready to change, but like the coaches that I worked with in CMH 10 years ago, I didn't quit using that year or even that 5 years, but somewhere down the road, I saw like, these are people in long-term recovery, and I heard some of their stories and saw how they managed to deal in all the toolbox, right? And so it's just that the living proof.
Okay.
So someone just wants to know, you know, the main difference between a recovery coach and a certified peer is a certified peer support specialist is a person who is living with a mental health diagnosis, whereas a recovery coach is a person who's living in long-term recovery from substance use. So these two are just double awesome, and they happen to be doing their most amazing work with both of those circumstances. Some people only have one of those circumstances. So that's the main difference. So if you were just a recovery coach, you would mostly be working through the substance use disorder and recovery programs. And if you were a peer support specialist only, you would be working through the mental health program. Right. So Rosemary and Desiree get to do both. We're lucky.
Desiree, I wanted to ask, I mean, I don't know about you, but I personally think that probably almost everybody is co-occurring. It's just a matter of whether it's come out or not.
I don't know.
I don't know. That's hard to say,
Right, that's
Rosemary.
a
That
hard one.
I'm a person in long-term recovery too. And
Yeah.
I have to say, I don't know. I don't know. Some people don't like substances, but I think the interesting factor here is that recovery can look so different and can be so beautiful. And I feel like being an alcoholic is like the best thing that ever happened to me now that I'm on this side of it.
Right.
I feel like, Desiree, you were so vulnerable when you were even just talking about swearing. Really, it was an opportunity for you to check yourself and say, is this what I want to do? Maybe it is, maybe not. But those moments, I don't believe I would get those moments if I didn't have sobriety. And I think that's exactly what both of you were able to so beautifully share in your story. It's absolutely beautiful. And there is another thing, Megan, I'm glad you brought that up. I did want to talk about that. I know that we talked a little bit about COVID and things with the pandemic. Actually, at Macomb County Community Mental Health, I feel like COVID has actually helped our services because it forced us to have to do something different, something that we didn't necessarily take as seriously as we needed to. And both of you alluded to it. Childcare, transportation, gas money, all of that stuff prevented a lot of people from accessing care. And during COVID, this whole telehealth thing and Medicaid opening up its eyes to say people might need to be seen in their own home sometimes. And they don't even have to put pants on sometimes. They can still have therapy at home and nobody has to know what's going on.
So just to get the question on the recording, Stephanie, can we say the question out loud that you're answering? Just to get
I'm
it on
so
the
sorry.
recording?
I am so sorry. I forgot about the recording. So has there been a rise in the need for services since the pandemic? And are there new services to meet the needs? So yes and yes. There's been a rise in need. And I think even people that were kind of walking on the fence, like maybe I might need help, but maybe it can wait. The whole crisis of COVID forced people into a situation where it was too difficult to say, maybe I don't need help. So more people were coming forward. Some of these other services, telehealth related, and like what, I'm so sorry. Sharon, Susan, what Susan was saying about Judson Center being a certified community behavioral health clinic, a CCBHC. Several CCBHCs and health homes opened up around our county to provide a better array and access to services that were not necessarily available before. So it was kind of like the perfect storm in the way that as needs were rising, we were forced to take a look at how we were delivering services to people and make it better. And I do believe it's more accessible now. I don't know how others feel.
I think it's more accessible and we still have a long way to go because I've found I was really lucky with how I ended up into CMH and had a wonderful fit and didn't have to jump through a bunch of red tape and wait forever. But, for let's say whatever other insurance you might have, there's just so many hiccups where I've experienced it. Other people that I know that like kind of know how to navigate things and kind of have been through this before and get very frustrated. I'm not trying to be negative, but just knowing that like there is still a long way to go. There's just way too few supports for the need. There's so much need.
But
and any barrier is just going to make it for some people like they just don't have the bandwidth to do it.
I agree with you, Rosemary. Point well taken. And at the same time, though, this is pushing us forward to have to look at service delivery. So I feel like at least we're moving in a better direction because I feel like we weren't really doing anything a couple of years ago to make access to services any better. And now we are. So I'm going to take it as a win. Even if it's a tiny W, I'm still going to take it as a win.